We want to bring in Dr. Stephen Corwin now. He is the CEO of NewYork-Presbyterian, one of the main hospital groups in New York City. Dr. Corwin, welcome. Thank you so much for joining us. You know, back in May, you said that New York City seemed to be past the worst of the coronavirus. You were on the front lines during the peak. Is the city perhaps heading back to a dangerous place, or do you think that if there is a second wave, it won't be nearly as bad as the first?
Well, we just don't know if the second wave will be as bad as the first. There's just no way to predict that. We hope it won't be. I think the governor has been extremely assiduous, as has the mayor, in terms of watching the positivity rates. And I think the mayor recommending that we throttle back some is a key recommendation. This can get out of control pretty quickly. And I think that was the prudent thing to recommend. Hopefully we'll be in a situation where we keep that positivity rate down, where masks, social distancing are coupled with a careful reopening of the economy, and where we can get to a point where we can get through this. The virus hasn't gone away. We don't have a vaccine. We don't have definitive treatment. The virus hasn't gone away, and we have to keep reminding ourselves of that so we don't become complacent.
So you agree with New York City Mayor Bill de Blasio's mandate to close several areas dictated by those zip codes that are seeing a spike. Do you believe that this is enough to work, or do we need more extreme measures in other zip codes as well?
Well, I think there are a number of zip codes that are showing an increase. There are some in Orange and Rockland County, as you know. I think this is the first step. If it looks like it is not improving the situation, then I think more drastic steps would need to be taken. No one wants to see going back to a full city lockdown again. But we have to be really sort of mindful that the virus can get out of control quickly if we're not prudent about this. Certainly, the 47,000 employees of New York-Presbyterian do not want to see this happen again. And so it gets back to everything that you've seen, everything that you want to do. New York needs to continue to mask and social distance.
So talk to us about the situation with hospitals, obviously something you know intimately. Emergency room doctors and nurses have extensive experience dealing with COVID patients. Are they now better prepared for a potential second wave? Do they have all the PPE and safety equipment that was in such, demand the first time around?
We're much better prepared. We have a 90-day supply of PPE concomitant with our peak usage. At our peak usage, we were using 25 times the number of masks that we ordinarily use pre-COVID. We are well equipped on the ventilator side. Our physicians, nurses, personnel know how to treat it. But it's still, let me remind everybody, this is still supportive care. This is not, there's no definitive treatment yet. So we're much better at it. I think we're much better prepared. We really do believe that we can withstand a second surge. And we are very, very hopeful that it won't be as significant as that first wave, which was horrific, as you know.
And doctor, during that first wave, one of the biggest issues was also ICU beds. Does New York City have enough beds now if things get worse?
I think we do. We've been in constant touch with the governor. New York-Presbyterian as a system, we had 450 ICU beds at the beginning of the crisis. We created an additional 450 beds. We currently now have between 600 and 650 ICU beds. Because we did not dismantle all the ICU beds that we had. So I'm confident that we can meet a surge. And if we had to go back to the 900 ICU beds, we know how to do that as well. Hopefully it won't be that severe.
Testing is better, treatments are better, correct? So things are getting caught earlier, the treatments are more effective. So even if we were to see a major spike, are you confident that, New York City's medical professionals could keep it to a reasonable and manageable level?
I believe we can, but I still, I know that I sound like a broken record. We can't afford to become complacent. When I see football games where, like University of Georgia, where there are 30,000 people without masks, those types of things lead to spread. Younger people get it, then middle-aged people get it, then older people get it. So if we're vigilant, we can open the economy, we can avoid a calamity in terms of number of hospitalizations and go from there. But to answer your question specifically, yes, I think that we're ready for it and we can handle it, and hopefully it will not be as severe. I don't think it will be, but it's hard to know.
Right. All right. Well, Dr. Stephen Corwin, thank you so much for joining us. We really appreciate your